Oral lichen planus is one of the most frustrating conditions to manage in dentistry. Patients suffer from chronic pain, and clinicians often feel stuck relying on long-term steroid therapy with inconsistent results. But what if there was a way to move beyond symptom control and actually reset the tissue environment? Hello everyone, this is Raymond from Raymond's Dental Solutions. Today's video is a summary and clinical discussion based on a 2026 review paper titled High Power Laser Therapy for Oral Lichen Planus by Jakub Fiegler-Rudol and colleagues, especially in erosive and recalcitrant cases, and more importantly, what this means for clinical practice. This review presents a very important shift in treatment approach. It shows that high-power laser therapy, or HPLT, can be a clinically superior alternative to conventional corticosteroids. Steroids rely heavily on long-term patient compliance, repeated application, and carry risks such as candidiasis and mucosal thinning. In contrast, laser therapy provides a direct, controlled, and immediate local intervention. The difference becomes even clearer when we compare outcomes. Let's look at the key clinical factors. With high-power CO₂ laser therapy, pain relief is often immediate because the laser seals and denervates nerve endings during treatment. With topical corticosteroids, pain reduction is typically gradual and inconsistent and depends on repeated application over time. With the CO₂ laser, healing is faster with rapid re-epithelialization of the treated tissue. With corticosteroids, healing is generally slower and highly dependent on patient compliance and correct application. With laser-treated areas, recurrence tends to be lower because the treatment directly modifies the local tissue environment. With steroid therapy, relapse is common after tapering, since the underlying condition is managed but not locally reset. With CO₂ laser therapy, side effects are minimal, with no systemic burden. With topical corticosteroids, there is a risk of mucosal thinning or fungal infection, such as oral thrush. One of the most interesting aspects of this therapy is its threefold mechanism of action. Unlike low-level biostimulation, high-power laser therapy works through controlled ablation, selectively removing inflamed epithelial tissue, immune modulation, where localized heat disrupts T lymphocyte infiltration, and decontamination, as the laser sterilizes the treatment field. This combination creates an environment that actively supports healing. The review highlights the 10,600 nanometer CO₂ laser as the gold standard for treating OLP. This is due to its strong absorption by water, which leads to ultra-precise epithelial removal, minimal penetration depth, and excellent control in sensitive mucosal areas, using a super-pulsed mode with a defocused beam, typically around 4.0 to 6.0 watts. Helps prevent carbonization while maximizing therapeutic effect. From a clinical workflow perspective, this represents a major improvement. The review suggests that high-power laser therapy should be considered a first-line option for erosive OLP. Why? Because it simplifies treatment and removes one of the biggest challenges in managing these cases: the frustration of chronic non-responsive lesions. In erosive oral lichen planus management, the CO₂ laser allows clinicians to move beyond ongoing symptom suppression. Instead, it provides a way to perform a definitive local intervention. This means not just reducing pain, but actually resetting the tissue environment. And that leads to a more predictable drug-free pathway to healing. At the end of the day, the shift is very clear. High-power laser therapy transforms oral lichen planus from a chronic management challenge into a precise and controllable clinical procedure. Thank you for watching. Your successful business is my primary concern.